Do you suffer from nerve pain? It can sometimes feel like a burning, tingling, stabbing pain all day. We're going to look at two supplements to treat neuropathic pain. With more on this is neurologist Dr. Chad Domingue to give us some of those answers. Thank you so much for joining us on this.
Good afternoon, Liz. Always excited to share my homework with your viewers, and this is a
Yes.
very exciting topic today.
Yeah, it's good to get here from an expert like yourself. What causes nerve pain? What are some of the symptoms?
We've talked about nerve pain before, and again, I always joke as a neurologist, I'm the electrician of the body. And nerve pain implies that your nervous system is malfunctioning for whatever reason. The most common cause we see around in our neck of the woods of South Louisiana is diabetic neuropathy. But you can also have spinal cord injuries, you can have brain injuries, you can have neuropathies from toxic exposure, you can have a neuropathy from multiple reasons. But the bottom line is you have neurological structures that are functioning properly. So what should be a normal sensation becomes a burning, throbbing, pins and needles. Diabetic neuropathies will describe their feet being on fire.
Ooh, that does not sound good. Okay, you've got two supplements you want to focus on to treat this. I'll let you start with the first one. Not sure how to pronounce this, so I'll let you go with it. It starts with alpha.
Yeah, so there's alpha lipoic acid, and the second one is even more difficult, acetyl L-carnitine.
Okay.
These are natural substances that are in our bodies already, but people with neuropathies in general, they can have a deficiency of these supplements. And what these things do, let's start with alpha lipoic acid. It is a very strong antioxidant, right? So when we have nerve damage, we have all these nasty things come in that destroy the nerve fiber. So what alpha lipoic acid does is it tries to mitigate those nasty things, and it helps the mitochondria, which is the powerhouse of the cell, function normally. L-acetylcarnitine does a very similar action, helping the mitochondria, but it also helps the myelin, which is the insulation of the nerve fiber. So think about the normal wire, it has the insulation around it. So it helps the myelin function normally. And again, as we talked about abnormal nerve function, these supplements allow these nerves to function and fire at a normal rate.
And in what form do you use it? Is it an injection? Is it something you take?
Yeah, so we've done many supplements, and I always love it when I do this type of homework and it changes my medical practice. I was really impressed with this data. There's animal studies in rats, there's data on patients that are a year out. The doses I found on alpha lipoic acid, about 600 to 1200 milligrams a day. L-acetylcarnitine, those doses are anywhere from 2,000 to 3,000, divided in twice to three times a day. But the safety profile is really, really nice. No side effects, easy to tolerate. This is supplementation by mouth. You can also get this in IV form. So if you need like a boost, you can get this through an IV to help your neuropathy pain. But you got to love it when you look at a supplement with no toxic dose. And again, I love that house money analogy. You really have very little to lose on this.
And my last question, obviously you go to your doctor to inquire about this, but which patients would really qualify for this?
Yeah, so again, anybody with nerve pain, looking at the literature, the diabetic neuropathy is kind of what they've looked at the most. They've looked at some people with neuropathy from chemotherapy, which is a very common cause. But again, understanding nerve pain as a neurologist, I would say anybody suffering with nerve pain from any type of cause, you got nothing to lose here.
Some good advice. Always good to shed light on new treatments. Appreciate it, Dr. Shad.
I just want to say happy St. Patrick's Day and make sure to wear your green.
Nice.
Be safe out there. My new bow tie, I love it.
I like it. Very, very nice. Okay, appreciate it. Thanks, Dr. Shad.
My pleasure. Take care, Liz.